Okay.
So hi, everyone. This is Dr. Ron Hunninghake, and I'm joined by Dr. Gael Wheeler, who is a doctor of osteopathy in our Kansas City Overland Park office. Gail, welcome. And how are you doing today?
Oh, doing well, Dr. Ron. How are you?
I think I'm handling the stress pretty good, but we thought we would talk with you since you've got some extra training in stress management, and with this COVID virus thing, oh my gosh, people are totally out of their element. They're cooped up, they're isolated from other human beings. When you see people, you can't even shake their hands or give them a hug or anything. How does this kind of stress affect people, and what do we need to be watching out for with our patients? Or could you just address that a little bit?
Sure. Well, these certainly are unusual times. There's no doubt about that. And I mean, one of the things that we know is human contact is so important to our well-being. And that has been altered by this reality temporarily, and we have to keep that in mind. This is not going to be permanent, but it is something that we need to understand in the here and now. One of the things we know about as physicians that we know about stress is that, gosh, probably just about any physiological ailment that you can point to probably has its roots in stress. We're talking heart disease, diabetes, lots of different things. There have been studies done with women and breast cancer. Oftentimes there being a triggering event a couple of years before of prolonged stress. We know in the short term that acute stress can depress our immune system. And that's something we need so vitally to have robust right now. We know that in the long term, prolonged stress can affect so many different organ systems and lead to, like we were saying, everything from heart disease, diabetes, altered brain function, lots of different things. In talking about this, though, one of the things I always want to be really cautious about is I don't want patients to hear this and say, oh, that's yet another thing to stress about.
Stressing about stress.
Exactly. I think it's really important to realize that this is a normal human physiological function. It's part of our survival mechanism.
It's adaptation. We're attempting to adapt to the circumstances.
Absolutely, absolutely. And that primitive part of our brain, when it senses a threat, it automatically tries to protect us by raising our cortisol level, altering our circulation, all of these different, really pretty amazing physiological functions that our body does to try to help us, well, get away from the saber-toothed tiger that it perceives. And one of the things we need to do is assure ourselves that there's no saber-toothed tiger, that this is something that we will overcome. We are a very resilient species. Throughout history, humanity has been through so many huge events that were new to us, were novel to us, and were probably pretty scary at the time. And yet, step by step, we figured out our way through that. And we will with this too. And I think it's important just to know that collectively we can do this.
So what are some ways that people can utilize to gain more stress resilience? Because that's what we're looking for, is we want to be resilient in the face of these threats.
Absolutely, absolutely. And when we think of resilience, we think of that as something we can build over time. One of the things that I was thinking about this whole situation is this is kind of like our master class in stress management. We probably will never experience another collective time in our lives where we have this. kind of a situation that we have to try to manage. I think that what's important right now is a number of things that we can do, a number of strategies that we can do on a daily basis to help manage our stress and in the process build that resilience. One of the things that I think of is it's so important to be vigilant about the situation, but not hyper vigilant. We know that information changes on a daily basis as we learn more and more about this virus and how it affects us physiologically and what we can do about it. We want to stay on top of that, but we don't want information overload because that absolutely adds to the stress burden. Secondly, when it comes to information, I think it's really important to monitor the quality of information you get. You want to keep it science-based, you want to keep it reality-based. You know, keep away from people who are doing the whole conspiracy theory sort of talk about this whole thing. That doesn't help us. That doesn't help us figure out how to manage this, and it doesn't help our stress level. Another thing too that I think is a really important tool at this point in time is conscious relaxation. And when you're feeling stressed, that may not feel normal to do. Because your body's saying, hey, saber-toothed tiger. But we have to kind of take ourselves by the hand and make ourselves calm down from the inside out. And lots of different ways to do that. Some people can find some peace with meditation. Some people may be practicing mindfulness on a daily basis, these kinds of things. Each little thing that we do that helps us calm down helps cumulatively lower that overall fight or flight response. And that's what helps us build resilience in the long run.
You can always kind of tell a little bit about how much stress you're under by whether or not it's disrupting your sleep. And so a lot of people, I think, getting to bed on time, following a daily schedule, get some exercise, eat healthy foods, don't overdo foods. So get back into a routine, I think, can be very helpful.
Yeah, I think that's very, very important. And it's reassuring to us too. It helps us have a sense of control in our lives in a situation that may not feel like it has a lot of control. And I'm glad you mentioned the exercise part of it too. Exercise is really important. One of the things that happens when we exercise is it fools that primitive part of our brain that thinks that there's that saber-toothed tiger after us, fools that part of our brain into thinking, well, we've done something physical and we're still alive, we didn't get eaten, therefore we must be safe. And that feeling of safety is so important. That's one of the things that exercise does for us, one of the many gifts that it gives us in a situation like this. It helps turn that stress response around.
Right. And, we do have access to all this modern technology for allowing us to reach out and check in with other people. How are you doing? And share some of what we're experiencing with them, and realizing that we're not alone in this whole process, that we are still going together as a group and learning how to cope, and that as a family of people, we can survive better.
Yes, that is so true. We're really, really fortunate in that sense that these days we have this available to us, and it's a wonderful tool to stay connected. We're very, very fortunate that way. One of the things that I think is important too in that regard is those of us who may not be impacted quite as severely as some others who have, say, lost their jobs and are really struggling, like anything that we can do to reach out and help people who are really having a hard time going through this, whether it be through your church, your community organization, or somebody that you know, I think it's so important to as a family, connect and offer help where we can. That's another way that it actually reduces our own stress level too, in addition to helping that individual.
Yeah.
Yes.
So when we're going through this, what we say to ourselves is very important. So that self-talk, that kind of reassurance that we can even give ourselves and give to other people. Sometimes when we're reassuring other people, we're also reassuring ourselves.
You're absolutely right. That's so true. It works both ways, doesn't it?
Yeah.
Yeah. And one of the things that it's important for us to say when we're reassuring ourselves is really to contemplate that concept of resilience, both personally and globally. Many of us have been through trying times in our own lives in the past, and we found our way through. And in history, there have been many times throughout history that we collectively have faced challenges and threats that might have seemed insurmountable at the time. Yet we did find our way step by step through it. And to know that we are very resilient individually and collectively, even though we might feel scared sometimes, we might feel uncertain sometimes, that's natural. And to give ourselves the space and the grace to allow that to be felt and not to worry about it. One of the things too I think is really important is rumination. I think it's important to understand that when somebody is ruminating on something that's negative or frightening to them, what they're doing is feeding the fire of that stress level. And it's important to understand at this point in time what things in our lives help us and what things in our lives hurt us in relation to this particular situation. And to realize that the rumination really isn't helpful. That's just going around in stressful circles, and it doesn't get us anywhere.
Well, we're going to have to wrap up our conversation, but I wanted the audience to know and that Dr. Wheeler and myself, and we have Dr. Timms, Dr. Moffat, Mike Shaw's our PA. We have a number of resourceful people here on staff that are available for phone calls. Our staff is going to be reaching out to see if they can be of help to people. So don't be afraid to call the Riordan Clinic and let people know what your questions are, what your needs are. We have call times as well. Also, we have we're doing a program called IVC Now, where you can come in and get an infusion of vitamin C to boost up your adrenals. Vitamin C is a stress management tool that we don't think of it that way, but we need it to reduce oxidative stress as well as psychological stress. And so anyway, I want to thank Dr. Wheeler, Gail, for giving us some really good ideas, and I'm going to let you have the last word.
Oh, well, thank you. My pleasure. I enjoyed visiting with you. And again, as Dr. Ron said, we are all a family, and we can help each other through this collectively, and we will get through this. And we want to be able to come out the other side healthy in the long run. So.
All right. Good advice. So thank you very much, and feel free to give us a call if you need us, the Riordan Clinic. And so thank you for your ongoing support, and be well. Bye now.